Okay.
Hey, thank you for joining us today for this informative workshop, Taking Control After a Dementia Diagnosis, presented by Kelly Parsons, social worker with UK Sanders Brown Center on Aging. This workshop is sponsored by the University of Kentucky WorkLife. Kelly, thank you for your time today. Would you like to introduce yourself and get started?
Sure. Thanks so much. My name is Kelly Parsons. I'm a social worker at the Center on Aging Clinic, or excuse me, Sanders Brown Center on Aging Research Clinic. And today I'm going to be providing some definitions commonly heard when discussing memory and thinking problems, review some reversible causes of dementia, and talk briefly about memory medication. We're also going to go over some scientifically proven strategies to support brain health and discuss ways to stay engaged and active. Finally, we're going to be reviewing some things to be planning for as you move through a diagnosis of dementia. All right. Oh, there we go. So let's just jump right in and talk about our brain. If you can see my cursor, there are four lobes or regions of the brain, and each of these regions have specific functions. So the frontal lobe, that's really where our higher level of cognitive functioning is. This accounts for concentration, personality, emotions. This is also where our problem solving skills and our forward thinking skills come into place. This is our planning region, if you will. And then the parietal lobe, this is a sensory center, so it interprets bodily sensations such as touch, temperature, pressure, and pain. And then in the temporal lobe down here is the auditory processing. And so this region really recognizes sounds, tones, and loudness. Next and finally is our occipital lobe. This is the visual region that processes what you see. So really to think about this, all of the regions of the brain at some point do become affected by Alzheimer's disease. All right, I'm going to review a few of these definitions and then the others I'll cover later, but I just wanted to give you some definitions, particularly as you're going through medical providers. These are some terms that you might hear them say. So atrophy, when somebody says your brain has atrophy on it, atrophy is the irreversible loss of brain cells or neurons, also called neurons, and the connections between them. So neuro pathways of communication dies, resulting in decreased brain volume and shrinkage. So brain atrophy is a common feature for many of the diseases that affect the brain. Atrophy can be generalized, which means that all of the brain has shrunk, or it can be focal, which only affects a limited area of the brain. And this results in a decrease of functions in that area of the brain that I showed in the previous slide. I do want to note to some degree that brain shrinkage does occur naturally with age. So there is expected to be some brain shrinkage. However, if you have a neurodegenerative disease, there will be much more atrophy. So atrophy can typically be shown on an MRI. If you have been diagnosed with a memory or thinking problem and you have not received an MRI, I would encourage you to discuss getting an imaging referral from your primary care provider. So another word we hear a lot is cognition. Cognition is a complex group of mental processes that includes memory, attention, language, and decision making. And then mild cognitive impairment. We're hearing mild cognitive impairment or MCI a lot more these days because of our new drugs for Alzheimer's, which I'll talk about. But mild cognitive impairment refers to the clinical state between normal cognition and dementia. So the person with MCI, they may take a little bit longer to do things, but they can still accomplish activities of daily living. People diagnosed with mild cognitive impairment may progress to non-Alzheimer's disease forms of dementia or Alzheimer's disease. They may remain mild cognitively impaired until death, or they can recover to normal cognition. It really kind of depends on what's happening in their specific brain. So let's talk about dementia because I think the big question is what's the difference between Alzheimer's and dementia? Dementia is more of an umbrella term. It's a medical condition that describes a group of symptoms to include memory loss, confusion, problems with speech, paranoia, changes in mood and behavior, and can also include a lack of initiative. So it's really important if your doctor is using the term dementia and prescribing you memory medication that you find out what type of dementia you have. The optimal treatment for your care really depends on understanding the specific type because there are different medications for different types of dementia. So, just to recap, dementia is not a specific disease, it's a group of medical conditions. Alzheimer's is the most common form of dementia at 40 to 70% of those diagnosed. And then the second most common is vascular dementia. Vascular dementia has to do with blood circulation in the brain and can be responsible for strokes. So, to talk about Alzheimer's disease a little bit more, since it is the most common type of dementia, it is a neurodegenerative disease that's characterized by cognitive decline due to brain cell death, that atrophy that we talked about. So, this death occurs due to two proteins that are involved, amyloid and tau. So, amyloid beta is a protein that naturally exists in the brain, but in Alzheimer's, it becomes misfolded and grouped together. So there's a lot more amyloid in the brain of an Alzheimer's patient than a patient with normal cognition. These amyloid plaques block cell to cell communication and results in neuron death. These plaques, so Alzheimer's plaques are considered an early initiating event that interferes with neuron to neuron communication and can trigger a toxic cascade that leads to tau dysfunction. So, first comes amyloid and then comes tau dysfunction. So, what's tau? Tau is a protein that helps your neurons or your brain cells communicate. And tau tangles, they look like tumbleweeds in the brain, but they form due to a misfolded tau protein in the neuron. And once this protein misfolds, it accumulates into sticky thread-like structures that we call tau tangles. This buildup prevents tau protein from doing its job and damages the neuron from the inside out. So the amyloid plaques and tau tangles do tend to form a predictable pattern on imaging, beginning in areas important to learning and short-term memory, and then spreading to other regions. This is another reason you want to ask for an MRI, as it can be helpful when getting a medical workup for memory and thinking problems. All right, I'm not going to spend a long time on this slide. I just want to kind of introduce you to the types of tests that a medical provider might choose to order when going through a memory and thinking workup. So just a couple of highlights. Spinal fluid, they would do what's called a lumbar puncture or a spinal tap, and they would fluid from your spine would be analyzed for how much amyloid you have in the brain. They can also analyze how much amyloid you have in the brain on a PET scan. They do have PET scans to look at the level of tau as well. So the most important thing, again, you can do if you've been diagnosed with dementia or a memory and thinking problem is find out what type, because treatment will change based on the different types of dementia. You also want to make sure potentially reversible causes of a dementia diagnosis are looked into. These are the things that they might be looking for. So infections or inflammation, they're looking at meningitis or an encephalitis. Lyme disease can also cause memory and thinking problems. Metabolic issues like hypo or hyperthyroidism, vitamin deficiency or folate deficiency, again, can also cause memory and thinking problems. And really what I think medications and depression really are kind of the number one things. Medications, this can be a side effect of a medication or drug interaction. There is a list called the Beers list. It's spelled like the drink, Beers. And that list is a list put together by pharmacists that will tell the public what medications might cause memory and thinking impairment. You can also have medications interactions that will cause memory and thinking impairment. So speaking with your local pharmacist and getting a copy of your full medication list is very helpful when moving through a memory and thinking diagnosis, and sharing that medication list with all of your providers. So not only your primary care provider, but if you see somebody for if you see a cardiologist, if you see a pulmonologist, or an endocrinologist, you want to make sure everybody is on the same page as far as what medications you're on. Also, I do want to highlight depression. Chronic untreated depression has been shown to cause a 50% increase of risk in being diagnosed with dementia. It's important to talk to your primary care about options that might be treatable for you. All right, so let's talk specifically about memory medications. So these two medications have been around for a very long time. Sanders Brown was that did actually a research clinical trial for these medications. So cholinesterase inhibitors, these up here, if you've heard of them, they prevent the breakdown of acetylcholine. And acetylcholine is a chemical messenger that's important for learning and memory. Cholinesterase inhibitors are medications that help brain cells communicate better with each other. Just imagine acetylcholine is like a text message between brain cells. These medications help keep the messages from being deleted too quickly. This medication can come in a pill or you can wear a patch. Typically, this is the first medication you will be prescribed if you do have MCI or dementia. So in the NMDA receptor antagonist medication, brand name Namenda, generic name Memantine. So NMDA is a glutamine receptor that's found in nerve cells, and it helps with learning, memory, and attention. Think about the NMDA as being the highlighters of the brain texting system. In Alzheimer's disease, the brain can become overstimulated by the glutamate receptor, which can damage brain cells over time. Memantine, or brand name Namenda, acts as a dimmer switch on the glutamine receptor so the brain doesn't become so overwhelmed. So a group of medications, when you think about these medications, if you are on them, you do want to stay on them. And I'll explain this in this. So it's very important if you've been diagnosed with MCI or dementia, you speak with your providers about these medications if you're not already talking to them. Research has shown that these medications taken together over time helps extend independent activity up to 3 years. Please note it's very important you stay on these medications if you're regularly taking them. Stopping medications due to a surgery or a hospital stay can often grossly affect and quicken the decline of memory and thinking problems. All right. So we also, Sanders Brown was also part of the clinical trials that studied Leqembi. We did not do the Kisunla in our research clinic, but we did do the Leqembi. I'm not going to get into a lot of what they are. I will say you do need a diagnosis of mild dementia or MCI. You need a referral from your primary care physician to a memory clinic. I know Baptist Health UK and Norton and Frankfurt are all close by and have a memory clinic available. And then if you want more information specifically about Leqembi, Dr. Koskin from Sanders Brown has a great talk on YouTube. And I believe Hazel sent the slides, and the link should work in the Adobe slides or the PDFs that were sent. I made sure to check on those. Okay. Not going to talk about this a lot, but I do want to kind of give you an idea of the tests that are done and why they're done. There's a lot of tests that will rate your brain and thinking ability. One is a Montreal Cognitive Exam. It's this one, or called the MOCA, and one is called the MMSE. If you have been diagnosed with memory or thinking impairment, it's important that your provider takes these tests at least yearly. Based on the scores that you receive, there are parameters in place regarding safety, decision-making capacity, and assistance you might need with activities of daily living. What can a cognitive exam, like an mini mental status exam or a Montreal cognitive assessment tell us. They talk about driving parameters. This is again a link about the Academy of Neurology practice parameter driving with dementia. If you have questions about that, it's a great resource. It can also, cognitive exams can also track progression of the disease. Okay, so we've talked about what can help from a medication standpoint from a dementia diagnosis. You can actively do things that will help with resilience and brain health. Um, of course, managing your health is very important. A Kaiser Permanente study looked at cardiovascular risks. People with hypertension were 20%, 24% more likely to have dementia. People with diabetes were much more likely to have dementia. And people who smoked were much more likely to have dementia. So, one thing I do want to highlight on here is complete preventative health screenings. So, hearing, there is a correlation between hearing and dementia getting worse later in life. Certainly, your vision checkups, your teeth checkups, um, your immunizations, things like that. I did put on here if you do have a diagnosis of MCI or early stage dementia and you're talking about a surgery with a medical provider, you absolutely want to talk about anesthesia. There is some studies that do show a risk in getting anesthesia and increase dementia. Okay, exercise. So exercise really quite is the miracle grow for your brain, and this is the study that talks about it. When you exercise, you produce what's called a brain-derived neurotrophic factor, which is a protein that promotes protective neuron pathways. So exercise raises levels of this BDNF protein. And it helps with growth, maintenance, and survival of neurons. So this is the control that didn't exercise, and this is how much neuron growth their brain had. This is the people who did exercise, and this is how much growth that their brain had. So, what is recommended exercise for brain growth? So, you want to do an aerobic exercise like brisk walking, swimming for at least 150 minutes a week. And then you also want to try to do some resistance training. Consistency is really the most important thing. You want to do this on a consistent basis. Certainly, we all have days or weeks that we might not feel like doing it, but always get back on the horse and help. So diet, of course, we know this, but this is the study that also talks about it. A healthy diet can prevent or delay an Alzheimer's diagnosis for almost 3 years. So the Mediterranean style diet is really what they're looking at. It's high in olive oil, nuts, fish, poultry, fruits, dark green leafy vegetables, low intake of high fat or dairy, red meat, and butter. So on this link here, or if you're watching this and don't have the slides, you can type in this link and it'll take you to the Mind Diet website that has wonderful information, a plethora of information about the Mind Diet and how you can incorporate it in your routine. So these are really protective and resilient factors that I'm talking about. Protective factors kind of negate out risk factors, which is always really great. So research tells us that an increase in social engagement provides a decrease of impairment in completing activities of daily living, cognitive impairment, and it decreases depression. So these are some of the things, if you're local to the area, that you can do. OLLI is a great program, Office of Lifelong Learning. You can sign up for classes. You can just attend community seminars. They have everything from bird watching to music to language classes. It's just really great. Also available is Lexington Senior Center, public libraries, and for other counties that are looking for their senior centers, if you click on your local area on aging and call them, they can direct you where your senior centers are. And senior centers always have something going on. They're a great place to stay social. Okay, another thing they found in research is sleep is a protective factor. Amyloid plaques are cleared out of the body during sleep, and the less REM sleep you receive, so rapid eye movement sleep, that real deep sleep, the less REM sleep increases your chances of developing dementia. Okay, so another thing so think about doing different things. Go to work on a new route, brush your teeth with the opposite hand, and go to a different grocery store. Going to the different grocery store is going to allow you to look up, to read signs, to be active instead of that just kind of pilot mode of going, you know, exactly where the milk is, you know, exactly where the rice is, that kind of thing. So a diagnosis of dementia or mild cognitive impairment, really, I think, kind of puts people into gear about planning for the future. And these are some things that you want to think about. So you want to think about naming somebody as a durable power of attorney. You want to look at advanced directives. So these are medical choices that you would want someone to make if you're no longer able to make them. You also want to think about what staying at home looks like if you have mobility issues. You know, are there 10 steps to get from the garage into the house? Is your bedroom on the top floor? Is there a bathroom on the first floor? Those are kind of some of the things that you'll want to think about. And then just discuss a discussion of increased care needs, who will manage what, things like that. So, for more information about legal and financial and long-term plans, this Alzheimer's treatment and next steps after an Alzheimer's diagnosis from the National Institute on Health is really detailed and goes into a lot of things. And just for the PDF that you got, if you want to hold down the central CTRL button and then click on that link, that should take you directly to that website. Let's see. Oh, and I think in the Alzheimer's Association has support groups. They have online support groups and in-person groups. They are typically the in-person support groups are typically in the bigger cities, so Louisville, Bowling Green, Lexington, things like that. Meredith Plant is the Lexington region Alzheimer's Association direct or in person. She can be reached at this number, 214-610-6106, excuse me. And then if you also want to look through social media, a lot of social media has specific support groups that are run. They can be run by an organization, they can be run by a group of moderators. It just kind of depends. So I talked a little fast. Does anybody have questions?